Good afternoon, everyone. Thanks for joining us here today, and thanks again to Dr. Brent Roussin for joining us, and thanks, Doc, to you and your team for all your work on behalf of Manitobans. We sincerely appreciate it. We are taking another step today, a good news day, towards a reopened Manitoba, fully reopening our economy and our communities and getting our lives back is our goal here, and this is a positive step today. Manitoba's 4-3-2-1 Great Summer reopening plan sets out a clear path for more openings and fewer restrictions as more and more Manitobans are rolling up their sleeves and getting vaccinated fully. Last week, Manitobans met and surpassed the vaccination goals we had set out for our second reopening milestone. This, I should note, was almost a full month ahead of schedule. So good for Manitobans. Thanks so much for doing that. As of today, nearly 77% of Manitobans have received their first vaccine dose, and over 58% of Manitobans are fully vaccinated with both doses. I'm also pleased to share that we've administered now over more than 1.6 million doses of vaccine. That is a significant accomplishment. Our vaccine team has performed so admirably, and we thank them for that. And that is among the very best records in the country. So Manitobans should be proud of their collective efforts to protect one another and themselves, and also I hope they're very proud of the work that our team has done on their behalf and to help them to get those things back they've missed for the last year and a half, and that we all want to get back as soon as possible. I want to say also thanks for not only rolling up your sleeve, but for your commitment to follow our public health orders. We can't lose sight of the fact that those public health orders are there to help guide us and protect us, and to make sure that we protect one another as well, and to keep bending that COVID curve down. Those case numbers have been coming down thanks to people's efforts, not only to get vaccinated, but also to follow public health orders. We want to move forward. We want to loosen restrictions more, but today we're announcing some effective changes that will come into play, I think, 12:01, Brent, on Saturday morning.
Correct.
All Manitobans will be able to enjoy more freedom starting then, with expanded indoor and outdoor activities. And fully immunized Manitobans who have received both doses at least 2 weeks ago will continue to enjoy even more benefits for doing their part to protect themselves and their community. Under the new public health orders, fully vaccinated Manitobans will also be able to go to a movie or visit a museum. And these are things that many Manitobans hold dear, and I know you'll find that to be exciting news. Vaccines are the safest and quickest way to get us out of this pandemic. They are our protection against a possible fourth wave, and that wave is very possible. It's a question of the degree to which we experience it. The more people that get vaccinated, the less impactful that fourth wave can be. This is how we get our lives back. I'll now pass it over to Dr. Roussin to expand on on the new health orders and possibly even a little good news for Winnipeg Blue Bombers fans as well.
Thank you, Premier. Good afternoon. I'm Brent Roussin, Chief Provincial Public Health Officer. Today is yet another significant day in our battle against this pandemic. We've all worked hard to get here by following the public health orders and getting vaccinated. And this has been paying off as we are now getting closer and closer to a post-pandemic Manitoba. I want to thank Manitobans for their hard work and their dedication and sacrifices. Effective 12:01 a.m. Saturday, July 17, all Manitobans will benefit from these changes, including indoor gatherings at private residences are permitted to a maximum of 5 persons. That's in addition to household. Indoor gatherings in public spaces are permitted to a maximum of 25 people. Outdoor gatherings on private property increased to a maximum of 25. Outdoor gatherings increased to a maximum of 150 persons in public outdoor gatherings. Retail businesses increased to 50% capacity or 500 persons, whichever is lower. Restaurants, licensed premises, and food courts, their capacities expand to 50% capacity. Outdoor maximum table size remains at 8. Patrons may only sit together indoors if they're from the same household, or all patrons that are 12 years or age and older are fully immunized. Unvaccinated children under the age of 12 may dine with the fully vaccinated members of their household. Opening hours extend to midnight. The requirement to purchase food when ordering alcohol no longer applies. VLTs may be operated with all other restaurant and bar rules applying. 2-meter distance between machines, and households and fully vaccinated people only are allowed to sit together indoors. Personal services such as haircuts and styling, nail salons, estheticians, massage continue at 50% capacity, but appointments are no longer required. Dance, theatre, and music school capacities increased to 50% capacity to a maximum of 25 persons per group. Indoor sporting facilities may host groups up to a maximum of 25 people, but interaction between those groups and tournaments are not permitted. Day camp capacity increases to groups of 25, but joint activity between groups and overnight camps are prohibited at this point. Outdoor recreation, including games and practices, may take place to a maximum group size of 50 persons. Spectators are permitted and do not count towards the capacity limit, but tournaments are not permitted at this time. Gym and fitness center capacities expand to 50% capacity. Masks and the 3-meter distancing between patrons still applies. Outdoor weddings and funerals may include up to 150 participants, in addition to photographers and officiants. Indoor weddings or funerals increase to 25 persons, in addition to photographers and officiants. Libraries may open to 50% capacity to a maximum of 150 people, whichever is lower. Faith-based and cultural gatherings such as powwows, sundances may expand to 50% capacity, or 150 persons indoors, whichever is lower. Masks and physical distancing between households is still required. If the facility design allows, the capacity limits may be applied to different physical spaces within the venue. Outdoor faith-based and cultural gatherings are permitted to 150 people, and the drive-in services continue to be permitted without restriction. Large-scale outdoor professional sports or performing arts events may be able to operate with capacities up to 100% after developing an approved event plan in consultation with public health. And at this point, I can announce that public health has approved the Winnipeg Blue Bombers game on August 5th to take place with 100% capacity to fully vaccinated fans. So these orders are scheduled to expire on 12:01 a.m. Saturday, August 7th. Following the fundamentals and washing your hands, physical distancing, wear masks are still all required. Most importantly, we need Manitobans to continue to get vaccinated. Whether it's your first or second dose, get vaccinated as soon as you can. And we know that a vaccine has the benefit of protecting you, protecting the people around you, protecting Manitoba. And there's additional benefits as we reopen Manitoba. Movie theaters, bingo halls and casinos, museums and galleries may now open to fully immunized people only, to a maximum capacity of 50%. Museums operate under the fully vaccinated requirement when open to the public as a museum, both indoors and out. If the museum is used as a private venue for another purpose, such as a wedding, then the appropriate orders will apply in those circumstances. Unvaccinated children under 12 may attend these facilities as appropriate if accompanied by fully vaccinated members of their household. So book your appointment for a vaccine. Today is a walk-in-a-thon at all super sites throughout the province, so it's a perfect day to get your vaccine if you have not yet done so. Pfizer and Moderna are both available, so make your vaccine appointment today or visit one of the super site locations today. More and more vaccinations allow us to loosen the public health restrictions, but we know COVID is still here. We still have daily cases. We still have Manitobans in ICU due to COVID. So we need to stick to those fundamentals. We need to get vaccinated. But we're going to continue with this phased reopening and as a safe reopening. So thank you again to Manitobans. I'm going to pass it back to the Premier.
Thanks very much, Dr. Roussin. And despite the progress we've made, and it's much progress together over the past few months against this third wave in the pandemic, there's more work to do. And I encourage all Manitobans to remember to follow those health restrictions. It's worth celebrating today's announcements, but it is also important to remember this is a marathon, this isn't a sprint. This is a tough adversary, and we need to be diligent. And we're not at the finish line yet, and the race to beat COVID isn't over yet. And until that race is over, Manitobans must continue to do their best, as they have been doing, to follow the health orders and to get vaccinated. So please do that. Protect yourself, not once but twice. And we are close to achieving our vaccination milestones earlier than we had initially targeted. We just need that extra effort by every Manitoban not yet vaccinated, roll up their sleeve and push us across that finish line so we can fully reopen safely and quickly. More to say later in the week on a number of the great community projects that people across the province are participating in to reach out and encourage others. And Brent had alluded to already the province-wide walk-in Vaxathon that's on today, and we encourage everybody to get out there. And we've converted all our super sites over to walk-in only today for any and all eligible Manitobans. If you'd like to take us up on that offer, visit protectmb.ca, find out a location nearest to you. If you haven't been vaccinated yet, show up and roll them up. Show up at the super site near you, roll up your sleeve, and protect yourself and your family and our community and all of us from COVID. Roll up your sleeve to win, too. I'm reminding Manitobans that we do have an opportunity to win back our freedoms, and everybody wins in that. But there is an opportunity here to roll up your sleeve as a chance to be a winner in terms of part of the $2 million prizes that are coming up for Manitobans. There was a bit of a statement on that yesterday, but I wanted to just add a word to remind Manitobans that you still have a chance to win one of many cash prizes if you get your first dose on or before August the 2nd. And you can be entered in the second draw if you get your second dose on or before September the 6th. So August 2nd for the first draw and September 6th for the second one. For more information on the vaccine lottery, visit vax2win.ca, vax2win.ca. To put it in terms of numbers, to achieve the Labor Day immunization milestone that we had originally established in the 4-3-2-1 Great Summer Plan that we outlined for Manitobans, our reopening plan requires us to get 24,000 more first doses done and roughly 87,000 second dose vaccinations done as well. To put that in perspective, our vaccination team has built an infrastructure where we could deliver that many vaccines in 1 week. We just need Manitobans to come forward, and encourage you to do that. It's a beautiful time of year. There's lots of things to enjoy and celebrate, but I don't think there is any doubt that getting your vaccination and getting your second one is something to celebrate too, and we'll celebrate with you when you get that done. I'm confident we can do this. I'm confident because I believe in Manitobans, and I believe that our efforts have been sincere in asking Manitobans to consider making this choice. In selecting to roll up their sleeve, we're going to be able together to hit our September long weekend targets even faster than we hit our August ones. And that's good news. Each of us has a role to play in protecting ourselves and in protecting the people around us. And so please don't let up. Get vaccinated as soon as you can and keep following those public health orders. I just wanted to conclude on another issue, non-pandemic, but to share with Manitobans that we have worked very, very hard as a government in partnership with our municipal governments to get 40 infrastructure projects, which are collectively worth hundreds of millions of dollars, approved. And they have been waiting approval for funding under our infrastructure agreement, which is called ISIP, an infrastructure agreement with the federal government. We're ready to move ahead. We would like to formally announce these projects with our federal and municipal partners as soon as possible. We want to get shovels in the ground as quickly as possible, and this will help create and maintain thousands of jobs for Manitobans. And this includes one of our real priority projects, which is the North End Pollution Protection Plant for Winnipeg. That's a top priority for our government. It's been a top priority for us to help clean up Lake Winnipeg. It's a treasure. We all know that. And the sooner we can get that project moving ahead, the happier we'll all be. So we have proposed announcing these projects as soon as possible with the federal government. We're just awaiting their confirmation, and we're all excited about it. I know the federal government wants to move ahead too, and so I'm looking forward to sharing these details together with our federal and municipal partners on these important projects as soon as possible, not just because they create jobs in the short term, but because they also build our economy and strengthen it for the longer term, and they make our communities cleaner and greener too. So with that, happy to take your questions.
Thank you, Mr. Premier. Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Free Press, Dylan.
Good afternoon, Premier. 2 of your MLAs are not vaccinated, and your party caucus won't say if this is because of any medical reason. How can you tell Manitobans that they need to get their shots as soon as possible when 2 people on your own team haven't done so?
Well, I'm not going to be talking about personal health details with anyone. That's the choice of every Manitoban. We've respected that choice and that right of Manitobans to make decisions with their own body from the outset. We're going to continue to. I don't know any government in Canada for sure that would espouse any other position. So we're going to continue to do everything we can to encourage Manitobans to make the choice of getting a vaccination and then getting another one. And we think that's the right thing to do, and that's what we'll be continuing to stay focused on.
And Premier, the issue of unmarked graves involving residential school students has triggered a reckoning across this country. In your view, what does the discovery of these graves say about our country? And did you and Minister Clark see eye to eye on that issue?
Absolutely. I think this is a tremendous opportunity for us as Canadians to better understand our history and better understand the mistakes of the past so they aren't repeated. And I think there's a real willingness on the part of Canadians to move forward, to build and work together for those goals of reconciliation that are not exclusive to, but part of the Truth and Reconciliation Report itself. I was certainly involved in working on reconciliation efforts with Indigenous and non-Indigenous groups for many years before the TRC report. But I know that Manitobans and Canadians want us to see progress on these issues. We've made some progress. We're excited to make more. And we'll have more to say on this in the coming days.
From Global News, Joe.
Afternoon, Mr. Premier. On that same topic about your Indigenous and Northern Affairs Minister who resigned, when did you find out, and do you take any responsibility for your role in it being because of your comments last week?
Well, I'll stand by my comments last week, Joe, but I have nothing but respect and love and admiration for my friend Eileen Clark. I've known her since I was 21 years old, so that's not going to change. You know, that's a tough portfolio, and Eileen's done a tremendous job in it. We need to continue with the work that she's helped us set the stage for doing more with. And so I'm tremendously appreciative of her work, and I'll never stop loving Eileen Clark.
Thank you. And then just on the topic of the restrictions, we're hearing from some people that it's just too hot to wear masks right now, especially for workers in certain jobs who have to wear them all day, and even people at the gym. So is there any consideration being given to relaxing the mask rules, or what it would take to relax those rules?
Yeah, and so right now this virus is not done with us. We're still seeing the virus. We're still seeing severe outcomes related to the virus, but we're definitely in a position to be able to loosen the restrictions. I think the continued utilization of masks allows us to loosen other aspects of the orders right now. So we are considering, like I said, we are moving toward a post-pandemic Manitoba where we're going to be in a place where we have recommendations regarding many things, including masks, but not orders. But we're not there quite yet.
From the Brandon Sun, Kimberly.
My question is for Dr. Roussin. Dr. Roussin, it's obvious what's going on with the fully vaccinated. They have privileges. There's a Winnipeg Blue Bombers game that fully vaccinated individuals can attend. But can you just flesh out a little bit more what's going on with the non-vaccinated? So no access to events and no openings, and just walk me through that if you wouldn't mind.
So where we're at right now is we're in a transition. We're in this stage where we can safely reopen certain things and in certain manners. But we are in that transition towards, like I've been mentioning, a post-pandemic Manitoba, and we're going to have recommendations and not orders. But right now, we know vaccine is the best way, the safest way to protect ourselves, the people around us, and other Manitobans. And because so many Manitobans have stepped up to get vaccinated, we're in a position to be able to open things up in Manitoba. And we're in a position to be able to open up even more of Manitoba to fully vaccinated people because we know the power of that vaccine. There's very few breakthrough cases that we see, and then even fewer severe outcomes in people who are vaccinated. So this is an interim measure, but it allows us right now to open up more because of the power of vaccine.
Okay, thank you. My next question is for the Premier. Mr. Premier, what do you think Eileen Clark's resignation and support for her resignation from one of your backbenchers says about the comments you made about colonialism and reconciliation?
Well, as I said, I'll stand by my comments. I continue to advocate that we build and not destroy, and I'll continue to say that we can work together, and when we do, we'll accomplish great things. Look, we work together here in Manitoba with Indigenous organizations on ending the dangerous practice of night hunting. We work together to get people back to their communities in the Interlake that some of them have been out of their homes for over half a decade. Work together to build Freedom Road. When we work together productively, and that's what we're after, then we can address the real issues of reconciliation that Indigenous people want. They want equality of opportunity in our province, in our country, in our world. And that's exactly what our government is focused on, making sure we work together with Indigenous groups on. We're going to continue to do that.
From CJOB, Clay.
Good afternoon, Dr. Roussin and Mr. Premier. First of all, Dr. Roussin, could be full house, Blue Bomber opener. Would you still advise people, that might be, if you're looking at full capacity at IGF, would you still recommend, if they're not eating a hot dog or sipping on a beer or whatever, to keep their mask on during the game?
Yeah, and it's good question and phrased appropriately about recommendations. So I think that this is, like I say, the path that we're going to be going is recommendations and not orders. So here we're going to be allowing 100% capacity. It's going to be only fully vaccinated people and those under age 12 who are accompanied by fully vaccinated people. So we feel that it's an appropriate risk for most people. And again, individuals are going to need to decide on their risk tolerance. In places where you're unable to distance, especially indoors, I'm going to be recommending masks for quite some time, not mandating them. In this outdoor setting, it's not going to be mandated, but I would say if you're unable to distance, then it is something that you should consider, wearing that mask if you're unable to distance from others.
All right, quick follow-up. I've been asked on behalf of some nightclub owners. I do not believe nightclubs are part of the reopening. envision nightclubs in Winnipeg, for example, to be allowed to open in the future? Talking about, you know, strangers maybe dancing with strangers.
Yeah, so with these orders, there's nothing that's required to be closed at this point. The activities at the venue are not going to be typical, right? We're still required to sit, with household members or fully vaccinated people at your table. So things like a dancing and other sorts of crowded mingling isn't occurring right now with these orders. But these orders really don't require anything to be closed anymore. Just certain activities may not be allowed at this point.
From the Winnipeg Sun, Scott.
Hi, good afternoon, both of you. I guess first one for the Premier. How do you expect Manitobans, and particularly Indigenous people in Manitoba, to take your commitment to reconciliation seriously, especially after last week's comments and ones before that?
Well, I'd like you to read last week's comments with an open mind and ask yourself, I didn't pay tribute to the building of this country by Indigenous and non-Indigenous people, because I did. And I'd like you to look at it with an objective heart and mind. And then you could look at my record and the record of my government in terms of working hard on reconciliation and making real progress on it. That's the key. We need results. We need to give equality of opportunity to Indigenous Manitobans and all Manitobans. Look, 700,000 acres of land has been transferred under my premiership and under my government. To Indigenous communities, there was virtually none transferred in the number of years before we came to government. That's just an example of our willingness to work with Indigenous leadership and communities towards real progress and real reconciliation. And we're going to continue to do that.
What do you say then to Indigenous people who don't appear not to favor your record when it comes to them?
Well, I would say that everybody's entitled to their opinion. I'm giving you facts. I've worked on Indigenous reconciliation issues for over 2 decades, advocating for more investment in First Nations communities for cleaner water, for housing, long before there was a TRC report. I've spent half a decade working with Indigenous women's groups on advocating for equal property rights for Indigenous women. What I would say to those folks is take a look at my record and be willing to come forward and build together, because our government most certainly is. My ministers are, I am, and we're excited about it, in fact.
From CBC Radio Canada, Charles.
Hi. How do you feel about other provinces opening sooner, like Alberta, where the mask is no more mandatory?
It works for them. Remains to be seen. We're at a later stage than other provinces in terms of the waves that came here, came later than they came to other provinces. We worked very diligently to bend the COVID curve down, but because of that, our situation is different than other provinces, and so our course of action that we've chosen to take is perhaps somewhat more cautious. Nonetheless, we're moving in the right direction, and with Manitobans' help, we'll continue to get those restrictions lifted and get our lives back.
And is there a plan to address the surgical backlog, which is becoming bigger and bigger?
Yeah, we've already, as a government, allocated $50 million towards this cause. We know that is probably just a start, but it's significant commitment on the part of our government. And as the chair of the Council of the Federation, I am able to tell you that every single premier across the country is working together in a united fashion to encourage the federal government to step up its investments in healthcare to a more reasonable and sustainable level as soon as possible, so that we can help each other address this really important backlog. This is people who are waiting in pain and in fear, who need to get services sooner. Every province alone can't address this. We need the partnership of the federal government that wants to address this issue, and it is an urgent one. I've asked for a meeting with the Prime Minister as soon as possible to get together to discuss this, and we are awaiting an agreed upon date from the Prime Minister's office for that to happen.
From CBC Manitoba, Peggy.
Good afternoon. This question is for Dr. Roussin. Dr. Roussin, we're still seeing a high number of people in hospital, particularly in intensive care. Can you talk a little bit about how Manitobans are expected to feel comfortable enough to participate in this reopening plan when there's still a lot of people in hospital and in intensive care and maybe as well out of province?
Yeah, and so you can see that from our the numbers, the case numbers have dramatically decreased over time, and so have the numbers in ICU. So we still have Manitobans in ICU, but certainly those numbers have declined. And then, like we said, we see very few fully vaccinated people needing admission to hospital or to the ICU, and you can see with each day there's less and less unimmunized Manitobans. So as we're moving forward in a fairly cautious manner, our numbers are supporting this reopening, and we're going to do so cautiously. We're going to see what happens over the next incubation period or so, and we're hopeful that we're going to continue our reopening plan.
Thank you for that. And this next question is for Mr. Premier. Premier, do you see Eileen Clark's resignation as a positive step towards reconciliation with Indigenous people?
Well, I think every person who comes into elected office deserves our respect, and Eileen certainly has mine, and I think of all her colleagues, there's undoubtedly a tremendous respect for her dedication and her efforts. And so I most certainly don't want to comment on anything other than the positive performance of her and her duties right from start to finish. I was able to recruit her to come to provincial politics, and I was pleased when she made that decision. I have tremendous respect for her, her family, her previous work as the mayor of Gladstone, as a community leader, as a business leader in her community. She's been a tremendous friend to me for a long time, and I have nothing but respect and admiration for Eileen Clark.
From the Canadian Press, Steve.
Premier, Ms. Clark said that your comments last week were part of the reason for her resignation from cabinet, and she's staying on as an MLA. So I would like your take on exactly what reason she gave you for resigning from cabinet, and the response that you gave to her.
I'm not going to be discussing personal conversations between Eileen or anyone else with you, Steve, and you understand why. I can only say that I have tremendous respect for Eileen and the work that she's done. We're going to build on that work. She's diligent in everything she's ever undertaken. She's done her absolute best at it. It's a tough role. This is a tough assignment for any minister, and certainly one that Eileen took on with great enthusiasm and competence. And so, again, I'll have more to offer, I suppose, tomorrow on this issue, but today I just want to leave it at that.
Okay, I'm not sure why we have to wait a day for a comment on this issue, but what does it say to have a cabinet minister resign, the Indigenous Affairs Minister, who's been in that portfolio since you were first elected in 2016, to resign in the wake of those comments?
Well, there'll be more to say on this tomorrow, as I just said, Steve. All I can tell you is that cabinet ministers, like all of us, have the opportunity to decide on their own future. And I respect those decisions, and I respect Eileen's decision.
From CTV Winnipeg, Jeff.
Hi, Mr. Premier. Do you feel you have the full backing of Cabinet and caucus right now?
Yes.
Why do you say that?
Because I do.
From City News, Mike.
Good afternoon, Mr. Premier and Dr. Roussin. This question is for you, Doctor. At this rate, with what we're seeing, obviously there's variables that come into play, but do we have a guesstimation on what time we would hit our third phase of the reopening path? And do you anticipate it being earlier than what we've set out for?
So it's difficult to know. Like you say, there's a number of variables at play, but we've been early at each phase so far, and we're quite hopeful we're going to be early for the next phase. And it's really up to Manitobans to continue to get the vaccine to continue to, as we reopen, to continue to follow the fundamentals, keep these numbers down. But we're quite hopeful that we'll be able to continue our reopening plans probably ahead of schedule.
Thanks for that. And my second question, outdoor table size maximums remain at 8 for restaurants. Can you explain why that hasn't changed in this part of the reopening?
Well, we thought that, when we allowed that at the last set, it was outdoor setting, lower risk, and so we sort of had a fairly large table size allowable, that table size of 8. We didn't really see much need right now to change that table size based on everything we're seeing here, because we already are allowing unvaccinated or non-household people to sit. There's no restrictions on who can sit at that table, so we feel that 8 is still an appropriate number.
From CHVN, Taylor.
Hi, good afternoon. The physical cards that people would use to show proof of their full vaccination are currently at a stall. It's going to affect a lot of people's ability when they don't have internet access to do these kinds of things. What do you have to say for those folks who rolled up their sleeves but can't reap these benefits yet?
Yeah, from what I know, there's a lot of work being done right now to try to catch up on any of this. So, I think that over time we're going to be able to get those cards out, and then of course there's other options with the digital right now, but it is something that's being actively worked on.
Thanks. And a lot of the typical date spots are opening. Do you have any advice for those folks who may be meeting their online match for the first time?
Well, I think that it's, the advice overall is the fundamentals. So we still want to ensure we're being careful, wearing the mask as appropriate, hand washing, applying the other public health rules, ensuring we're staying home when we're sick. And then as we're transitioning into that post-pandemic Manitoba, it's going to be people choosing what their own level of risk tolerance is. And so, as people, more and more people are getting vaccinated, then we have less and less risk. But, the fundamentals, including getting vaccinated, is what we need to follow in all circumstances, even when we transition out of public health orders. We're still going to have those fundamental recommendations.
From the Globe and Mail, Carrie.
Hi, thanks for taking my question. This is for the Premier. Earlier in this press conference, you had said that you didn't want to comment on personal conversations with Ms. Clark, but she's a cabinet minister who just resigned. This is a matter of public concern. So I'm wondering if you can explain to us what she told you, why she resigned.
I can only tell you, Carrie, that every cabinet minister has the opportunity to make their own personal decisions. That's not going to change. It always has been the case. There have been many cabinet ministers over many years that have made the choice to resign for any number of reasons. Eileen has spoken about her priorities and reasons, and I expect she'll continue to as you ask her questions. I don't feel comfortable in telling you what Eileen thinks or what Eileen wants to say. I'm quite comfortable with Eileen Clark, as I've made eminently clear here, and I'm quite comfortable and confident with you having any discussion you might like to have with her about her rationale. All I can tell you is I'm responsible for the Government of Manitoba's cabinet making, and I will continue to be.
Okay, so you spoke very highly of her and talked about how much respect you have for her. So she's resigned. A number of chiefs have come out in support of her resignation. I'm wondering, given that, does that not give you pause to maybe rethink some of your statements or approach to Indigenous issues right now?
I'm not sure I understand your preamble entirely. You've talked about people supporting her resignation, and I'm not sure what to take of that. I think most people who've worked with Eileen would be disappointed with her resignation. I would be one of those. That being said, I accept it, and we move on. And I know Eileen will continue to be an incredible contributor to our team in government. She always has been. When we were in opposition for a number of years, since we've been in government, she has served tremendously well in cabinet. And I know that she'll be assisting her replacement as well to get up on all the files and to do the best possible work that we can do on reconciliation. We'll continue to do that. I've been around reconciliation efforts for decades now, and I can tell you that they're always fraught with challenges and difficulties. But the reality is there are some of us who are dedicated to building and will continue to be, and we will have to overcome the resistance of others. That's the way it is. I'm going to continue with our government to do everything we can to improve the circumstances and lives of Indigenous Canadians and Indigenous Manitobans in particular. We have made amazing improvements. We need to do more. And I think that the discovery of these graves, for some people, a first-time thing, was certainly well referenced in Marie Sinclair's work. So it wasn't a surprise, I don't think, to many Indigenous Canadians, but it is a surprise and a shocker to many non-Indigenous Canadians. Is an opportunity for us to, again, build even greater support for reconciliation efforts, such as acting on the missing and murdered Indigenous women's work, which we have begun and have invested in, such as acting on mental health challenges, on addictions issues, on the justice file. We've invested significant additional money in First Nations policing as well, because security matters, and in many other initiatives. So Manitoba has focused on reconciliation and will continue to with this government. And Eileen Clark will continue with her work in the past to have been a major contributor in the past, but also to be a contributor in the future to the work we do as a government and as a team as we move forward on these many files.
From APTN, Michelle. From APTN, Michelle. All right, our final reporter this afternoon, Mr. Premier, from CBC National News, Cameron.
Hi, Premier. Hi, Dr. Roussin. On the vaccine cards here in Manitoba and kind of looking at the national picture here, Manitoba's got a unique card. I know, Premier, when you announced that we were going to do this, you had conceded that this could be a divisive issue in society. Wondering what concerns you may have now, or if you're happy with the way it's rolling out in terms of people that don't have that second dose, or unable, say, people from outside of the province that come into Manitoba, say a resident of Kenora that wants to go to a Bomber game, what kind of documentation they may carry, and whether Manitoba's documentation will be recognized in other provinces, given we have no national standard.
Yeah, no, there's a good series of issues there that you've raised, Cameron. I think that I'm a practical guy, and what I would like to see is all these restrictions gone when it's safe to do so. It will not be safe to eliminate all these restrictions until we hit certain targets. Those targets rely on us getting vaccinated, and so we're doing everything we can to encourage people to do that. But let's be clear here. Yes, people who get double vaccinated have additional advantages in this short-term period. And we're trying to do that, of course, to be safe and to encourage others to do the same. But also, everyone who isn't vaccinated or is yet to decide whether they want to first or second vaccine benefits as well. And so there's no losers in this. These restrictions, as they come off for everybody. The special circumstances around being able to go to a movie or a Bomber game if you're double vaxxed are extra privileges. But everyone else gets to enjoy more liberty in terms of going shopping or going to a restaurant or going to enjoy the company of others in greater numbers. These are good things. So everyone wins with this. The wins that we're scoring are because people are going and choosing to get vaccinated, and we need more people to do that. And so that's what we're after. We're going to continue to be after that.
Is there a threshold set for when those cards will no longer be required in Manitoba? And are you disappointed that the other premiers and the Prime Minister haven't come along with you on this?
No, every premier has the responsibilities for their province. I have the responsibilities for Manitoba, and our team believes very strongly that these Vax cards are a good initiative that can help to give people who choose to get vaccinated their lives back a little faster with some small additional benefits. We think that's important. But we hope this is not a permanent and necessary measure, obviously. Quebec has announced that they may be using the cards additionally in the event of a fourth wave, beginning in September, I believe. Other premiers have said they don't want to use the cards. Look, I'd prefer if there was no pandemic. I think we all would, but there is one, and it's continuing, and it's come back again and again and again. And it will keep doing that as long as we don't have enough people vaccinated. I think everyone understands that now. So we're going to continue to focus on things like the Vax Day we're having today, the community outreach to dozens of different community organizations reaching out and giving information and hopefully persuading some of their friends that they're influential with to go and get vaccinated, and many other initiatives that we're everyone. Thanks, Brent.